Should universal healthcare be a fundamental right? Hi everyone, today I'd like to discuss one of the most debated issues in public economics and social policy. Should universal healthcare be recognized as a fundamental right? Healthcare occupies a unique position in every society. Unlike most goods and services, medical treatment often determines whether people live healthy lives or suffer from preventable illnesses. For this reason, many countries guarantee universal healthcare through publicly funded systems. Others rely more heavily on private insurance and market competition. This raises an important question. Should access to healthcare depend primarily on an individual's ability to pay, or should it be guaranteed as a fundamental right? Supporters of universal healthcare argue that health is a prerequisite for exercising nearly every other right. Without adequate medical care, individuals may be unable to work, receive an education, or participate fully in civic life. From this perspective, healthcare generates substantial positive externalities. Vaccination programs, disease prevention, and early medical intervention benefit not only individual parents but also society by reducing the spread of infectious diseases and improving overall productivity. Another argument concerns market failure. Healthcare markets differ from ordinary competitive markets because they are characterized by profound information asymmetry. Patients generally lack the specialized knowledge required to evaluate diagnosis or treatment. Instead, they must rely on physicians and medical institutions. Furthermore, medical emergencies rarely allow consumers to compare prices or negotiate contracts. These characteristics limit the effectiveness of ordinary market competition. However, critics argue that universal healthcare may create significant economic challenges. Public healthcare systems require substantial tax revenue and often face rising expenditures as populations age. If healthcare services are provided at little or no direct cost to patients, demand may exceed available resources, resulting in longer waiting times and pressure on public finances. Critics also contend that excessive government involvement may reduce incentives for efficiency and innovation. Competition among private providers, they argue, encourages technological advancement and improves service quality. A system dominated by government financing may become less responsive to the patient preferences and slower to adopt new medical technologies. In my opinion, healthcare should be regarded as a fundamental social right because access to essential medical treatment should not depend solely on financial circumstances. Nevertheless, recognizing healthcare as a right does not imply that resources are unlimited. Governments must allocate medical resources efficiently, encourage innovation, and maintain fiscal sustainability. The challenge is not choosing between markets and public provision, but designing institutions that combine equity, efficiency, and quality. Ultimately, healthcare is both an economic and a moral issue. Economic analysis reminds us that resources are scarce. Ethical reasoning reminds us that every individual possesses inherent dignity. A successful healthcare system should respect both realities. So here's my question for you. Should access to healthcare be guaranteed as a fundamental right for every citizen, or should market mechanisms play a greater role in determining the distribution of medical services? I'd love to hear your thoughts. Thanks for listening. See you next time.